yung topic ko po is all about oxazepam drugs. So, ano nga po ba ang action ng oxazepam drugs? So, the action of oxazepam drugs is benzodiazepine derivative related to lorazepam. And effects are mediated by inhibitory neurotransmitter GABA, acts on the thalamic, hypothalamic, and limbic levels of CNS. The uses of this drug is to manage anxiety and tension associated with wide range of emotional disturbances, and also to control acute withdrawal symptoms in chronic alcoholism. Hindi po siya pwede sa mga patient na matatanda and debilitated patient with impaired kidney and liver function, and sa mga addiction-prone patient, and COPD, and with mental depression po. And ang pag-take po nito is oral medication, give with food, if GI upset occur. Ang drug effects naman po ng gamot na ito is sa CNS, nagkakaroon po ng drowsiness, dizziness, mental confusion, vertigo, ataxia, headache, lethargy, syncope, tremor, slurred speech, paradoxic reaction, or euphoria, excitement. And sa GI naman po, meron pong nausea, xerostomia, jaundice. And also sa skin naman po, meron pong skin rash, edema. And sa cerebrovascular naman po, nagkakaroon po ng hypotension, edema. Yun po. So, our nursing responsibility is to observe the older patient closely for signs of overdosage. Always report to physician if daytime psychomotor function is depressed. And always check the lab test and perform liver function, and while blood cell counts or on a regular plant basis. And always note the excessive and prolonged use may cause of physical dependence. And for the patient and family teaching, report promptly any paradoxic stimulation of affect and excitement with sleep disturbances that may occur within the first 2 weeks of therapy, because dosage reduction is indicated. And do not change dose or dose schedule, and refrain from using drug to treat self-diagnosed condition. And do not drive or engage a potentially hazardous. And always contact the physician if you intend to or do become pregnant during the therapy, about discontinuing the drugs. Always po tayong tumawag sa physician or kontakin po siya. And always withdraw drug slowly following prolonged therapy to avoid precipitating withdrawal symptoms like seizure, mental confusion, nausea, vomiting, muscle and abdominal cramps, tremulously, and sleep disturbances. And lastly, do not breastfeed while taking these drugs. So, the drugs that I will going to discuss is all about lorazepam hydrochloride drugs. So, yung action niya po is benzodiazepine derivative with hypnotic activity equal to greater than that produced by the barbiturate or chloral hydrate. And mode and site of action not known. Appear to act at the limbic and subcortical levels of CNS to produce sedation and muscle relaxation and anticonvulsant effects. And the uses of these drugs is hypnotic in management of all kinds of insomnia. And example is difficulty in falling asleep, frequent nocturnal awakening, or early morning awakening, or both. Also, treatment for poor sleeping habits. And syempre, hindi po pwede to sa mga taong impaired yung renal or hepatic function, and mental depression, psychosis, history of suicidal tendencies, and addiction-prone individuals, and also po yung older adult or debilitated patient, and yung may mga COPD po. And kung paano naman siya i-take is, tinitake po siya via oral. And binibigay po itong give one's patients in bed and ready to fall asleep. And syempre, ilagay din po natin ito sa container with the child-proof cap at 15 to 30 degrees Celsius. And yung adverse effect naman po ng gamot na to sa CNS po natin, and nagkakaroon po ng residual sedation, drowsiness, lightheadedness, dizziness, ataxia, headache, nervousness, and oppression and talkativeness. And syempre, nagkakaroon ng irritability, depression, hallucination, nightmares, confusion, yun po. And syempre, sa special senses natin, nagkakaroon ng blurred vision, blurring eyes, and sa GI, heartburn, nausea, vomiting, diarrhea, and abdominal pain. And sa body natin as a whole, nagkakaroon ng immediate allergic reaction, hypotension, granulocytopenia, example, rare po siya, and jaundice, rare din. So, our nursing responsibilities always monitor the effectiveness, hypnotic effect, is apparent on the second or third night of consecutive use of these drugs, and 1 to 2 nights after drug is stopped, because drug has a long half-life. And always po, isupervise yung ambulation, residual sedation, and drowsiness are relatively common. Excessive drowsiness, ataxia, vertigo, and falling occur more frequently in older adults or debilitated patient. Always din po natin i-monitor yung drug ingestion if the patient has a history of drug abuse. Prolonged use of large doses can result in psychic and physical dependence. And always check po yung blood test. Always obtain for blood counts and liver and kidney function with repeated use. And be aware that the withdrawal symptoms have occurred 3 days after abrupt discontinuation, after prolonged use, and include worsening of insomnia, dizziness, blurred vision, anorexia, GI upset, and nasal congestion. And our patient and family teaching is always avoid potentially hazardous activities until response to drug is known, and avoid alcohol. Concurrent ingestion with lorazepam intensify CNS depressant effects, because these symptoms may occur even when alcohol is ingested, as long as 10 hours after last lorazepam dose. And be aware of the possible additive depressant effects when drug is combined with barbiturates, tranquilizer, and other CNS depressant.